I was diagnosed with breast cancer in February 2012, and it was just one of those days that you really never ever forget in your life, to be told you have breast cancer. It's really in great shape and at a transition in my life, and I felt a lump in my left breast, and went to a local surgeon here, Dr. David Parker, and I found out that I was diagnosed with breast cancer. I had to decide a lot of major decisions in terms of what type of surgery, where was I going to go for the surgery, and I decided South Georgia Medical Center. I'm born and raised here in Valdosta, Georgia. All my health care has been at South Georgia Medical Center. It's been phenomenal in terms of the care that they've provided me and my family over the years. So I decided to have a bilateral mastectomy. I had both of my breasts removed and started the process of plastic surgery for expanders and then later on for implants. Dr. Parker recommended me to the Berrien Cancer Center. So I went to the Berrien Cancer Center and my oncologist, Dr. Forey right here. So he was my first experience, my first experience with the Berrien Cancer Center. One of the first things you think about when you're diagnosed with cancer is, how long do I have? You know, how long do I have to live? How long do I have on this earth? You know, you start to think about, you know, what's really, where am I going with this? But I met Dr. Forey. And we talked. He gave all these, I mean, he spent probably a couple hours going through all the information regarding breast cancer. I was stage 3 breast cancer. The breast cancer was in my lymph nodes. So as a result of that, I decided to go with the most aggressive treatment. And the most aggressive treatment was chemotherapy. And it was every other week.
And one thing I remember telling her very well was there are different types of breast cancers, and they all behave very differently. She had the type of breast cancer that expressed the hormone receptors and also is HER2 negative. And actually, even though her cancer was stage 3, she had the best kind of breast cancer. The best kind because usually we know how to treat it. And if you treat it very well, patients do very well.
I would get up in the mornings, get down there about 8, get home about 4 o'clock. But the greatest thing about South Georgia Medical Center was all the services were right there. And it was 5 minutes from my house. Awesome. So I could drive myself to Berrien by myself, sit there in the chemotherapy room, leave, go home, 5 minutes away. And I would have chemotherapy on a Friday. And then I would be off for the weekend, and I'd be back to work on Monday. So I was able to continue to work and have all the greatest care right there in the world. Then after the 6 months of chemotherapy, then I had radiation. And radiation was for 2 months, and the radiation was every day. So I was able to continue to go to work. And I went to work in the mornings, and I would leave and go for radiation on my lunch hour, and I would come back to work. And to be able to be in this community, that's what the blessing is for South Georgia Medical Center. You don't have to drive, 4 hours to Atlanta. You don't have to go to Jacksonville. You don't have to go to Orlando. The services are right here. Whatever that concoction is that you come up with, right? They can put it in the bags, throw it up in the port, go up in your body, and go home, and you can rest, rather than being driving up and down the road. And then to be able to still go to work. I was able to continue to work and not have to take time off for months at a time or all of that. So that's the blessing for South Georgia Medical Center.
So what we did was we designed a personalized treatment strategy for her that included she having surgery and then having chemotherapy and then radiation. And then we put her on endocrine therapy, which are pills that she takes and she's supposed to take for 10 years. Looking back, she's done very well. She was an amazing patient. She did everything that we told her. And she's made it beyond 5 years. This is when we start telling you are cured, and she's done phenomenally well.
You know, there are people out here in our community, there are women that one day life change. Hey, you have breast cancer, and they don't know what to do. And I want other women to know. That's why I'm here today, is to let other women know that there's somebody that can help them. And that's Dr. Ofori. That's the Perlman Cancer Center. The research changes every day. And, you know, he's up on research. I mean, he's constantly going to the conferences,
right.
and you know, he's reading the latest and the greatest. And so I thank you. And because of that, I live. Thank you, Dr. Ofori, and thank you, Perlman Cancer Center. Without you and without God, I would not be here. Thank you.
You're welcome. Thank you. Thank you so much. Appreciate it.